We are recording this today, everybody.
Good afternoon, everyone. Thank you so much for joining our first of three scheduled trainings with Telogen to help achieve a smooth transition from EQ Health to Telogen. So thank you so much. Jean is going to do the introduction, so I'm not going to spend time doing that, but just wanted to let everyone know that this group, the 1 to 2 p.m. scheduled training is meant for case management agencies. If you don't belong to the case management agencies, we have scheduled for hospitals and nursing facilities for the February 16th training. Hospitals is from 9:30 to 10:30, nursing facilities from 11 to noon, and of course, case management agencies 1 to 2. So just having that information, just in case there's anyone here that would like to be in any of those other group. And without, taking more time, I'd like to pass it over to Jean. Thank you.
Okay. Hi. Thanks, Obi. I'm going to be recording this session. We are going to be posting it online after. And as you can see, I have closed captioning on to provide us with some subtitles for folks that may have a little trouble hearing the audio. Want to make sure we have that feature as well. So greetings, everybody. Welcome to this Tuesday afternoon. We are going to be talking about Telogen, Qualitrak, and our PASRR Philosophy. So that is what we are here to do. I expect this training to run about 30 minutes. We'll have some time for questions and answers. And so far, this has been going pretty well. This is a great turnout. So let me cover our agenda for today and the purpose of this brief introduction. We believe it is important to relationship building to share and connect names with faces to the extent that's virtually possible, that is. We are going to cover today a bit about the company of Telogen for those of you who may be unfamiliar with us as an organization. Then we're going to take a look at the Telogen PASRR philosophy and what makes us unique. After that, we're going to provide an introduction to our web-based portal, Qualitrak. Then we can close with some next steps in training, then do at the end as well.
Nice.
And I am going to put out a word of warning to folks. If you are not presenting, please be on mute, just so that we can not lower the background volume for folks. So first up, who is who and what are their roles in supporting this transition? In terms of our virtual meet and greet, I will start with myself and the Telogen team. My name is Jean McClurkin, and I am an LCSW in 3 states, Colorado, Iowa, and Montana, as well as holding my LAC in the state of Colorado. My role for this purposes and how I will be supporting the transition is as the main contact for the clinical implementation. I have been leading PASRR efforts at Telogen in Montana since 2019, and I'm thrilled to be returning to Colorado. I have a long personal history in the state as working as a licensed behavioral health provider. I was at Arapahoe House for 10 years. I have experience in the Denver metro area for community behavioral health, as well as time working at Denver Health Inpatient Psych. Pam Valvano is also on our team, is the lead for the entire contract Telogen has with the state of Colorado HCPF, of which PASRR is just one aspect. She has been supporting Colorado healthcare initiatives for several years as she was involved in the Colorado Foundation for Medical Care, which some of you may be familiar with, before that merged with Telogen in 2014. And in addition to her passion for healthcare, Pam is skilled in IT systems and loves a good Excel spreadsheet, which we leverage pretty hard. Stephanie Wilson is our Qualitrak implementation manager, and she has over 19 years of experience in IT systems and implementation of new or transitioning systems. And she's one of our lead Qualitrak trainers. So we are lucky to have her. She lives in Iowa on an amazing ranch. It's beautiful out there. And her daughter is also an accomplished rodeo equestrian. In addition to these 3 named individuals, the Telogen team is made up of folks that are currently being hired and going through the onboarding process. They will be dedicated level 1 screen reviewers, schedulers of the level 2 evaluations, and then also level 2 evaluators. We will still be coordinating and contracting with a range of local professionals, boots on the ground, to support timely in-person assessments. Though we believe in providing a dedicated and consistent team, which we can build on for successful and deep relationships with all of our stakeholders. We want you to know our names, who we are, and how you can reach us for questions. All of our emails are up on this slide. And as I'll mention many times throughout the meeting today, all of these slides will be available as a slide deck to be able to get on a PDF document. We'll also be doing a transcript of today's session, some FAQs from today's session, and we'll be having the recording available as well. So all of those different resources will be available to folks. Telogen is partnering and being supported by individuals at the state for this effort. We have been having extensive communication and shared meetings for the last several months in order to prepare for this transition. And frankly, they've been a true joy to work with. So we're really happy about that. Obi is the lead PASRR administrator at the state in HCPF. He also shares the vision for person-centered PASRR. He is our main point of contact, providing oversight for this contract. He's been involved in PASRR for the last 4 years, and he is very well known as being a dedicated and involved dad. Michelle Voss is the Notice of Determination signatory for the Office of Behavioral Health, which serves as the state's mental health authority. And she is well known for her love of Palisade peaches, for enjoying time down in Pagosa Springs, and for baking tasty treats with her coworkers. Tricia Stone is the Notice of Determination signatory for the Office of Community Living, serving as the state's Intellectual Disability Authority. She's also for the Home Community-Based Services waiver, waiting list, and enrollment. She's the specialist overseeing that. She's also well known for her love of animals. Now, on to all of you, the PASRR stakeholders. There are 4 main groups of PASRR stakeholders that all have unique needs and unique challenges. There are the hospitals that serve as nursing home referrals. They complete PASRR level 1 screens. There's also single point entry, community center board, case management agencies like all of you that help to complete level 1 screens as well. And then there's the nursing homes that both complete level 1 screens for folks currently in their care, and they implement all of the level 2 recommendations. And last, but certainly not least, are the individuals, right? And their collaterals that are the focus of PASRR. Something important to mention here is that Telogen as a company believes in being accessible and being supportive to all of our stakeholders. As those of you that are familiar with Telogen from our other work can hopefully attest to. We seek to have open communication and seek out active engagement throughout the entire PASRR process, including post-level 2 follow-up that we do as well. The goal here is not to add any burden to your already full plates doing good work to help people in your community, but rather to assist and support you through the PASRR process. So now I want to cover a little bit more about Telogen as a company, particularly for those of you who are unfamiliar with us prior to this PASRR work. Telogen was first founded in 1972, and we are now 100% employee owned. This means that we have been around in healthcare improvement for over 4 decades. And the fact that we are employee owned is also important, as it allows us to stay very connected to our mission, which is to transform lives and economies by improving health outcomes. Our employee owners are committed to finding innovative solutions to actually make a difference in the lives of people and in the world of healthcare. Telogen began as a quality improvement organization, otherwise called a QIO, which we remain to this day. We serve Colorado, Iowa, and Illinois, so you may know us from that. These roots in striving for continuous quality improvement and member-focused care really do filter out through every diverse contract we have, including this PASRR work. We are a national company, but our headquarters are in West Des Moines, Iowa. We have offices from coast to coast in Des Moines, Baltimore, Denver, Boston, Chicago, Oklahoma City, Boise, and Richmond, Virginia. We currently provide population health management services and IT solutions to over 10 million Medicaid, Medicare, and commercial insurance members. We have over 650 employee owners that stratify into two main halves of our whole. We have half of our staff that are clinicians working as assessors, reviewers, case managers, physicians, nurses, social workers, and folks specialized in behavioral health coaching. And then on the other hand, we have our technical teams. We have technical folks that are working as statisticians, biostatisticians, business analysts, health information technicians, system developers, and reporting analysts. So this dual focus that's grounded in both clinical and technical expertise that's connected to a mission-driven employee ownership makes us a great fit for this PASRR work. We wanted to share a few things specific to Telogen's unique PASRR philosophy. And we feel that is just as important to present to you as who we are. First, Telogen views the PASRR process as a primary clinical opportunity to improve member care over just pushing paper for a federal requirement. This is an improvement opportunity. Secondly, timeliness, quality, and utility matter. We believe in a system that balances useful and relevant assessments with efficient and user-friendly technology. We want to add value for all of our stakeholders. Third, though we are relatively new to PASRR, we are not new to healthcare improvement or to clinical assessment. This makes us nimble. It makes us open to learning so we can adapt to your process here in Colorado and help improve it at every turn. We are not married to a 20-year-old process. We can stay nimble. And also we can leverage national best practices with our national focus. A next important aspect of our philosophy is that we are holistic and person-centered in our approach across all of our books of business. This is a great fit for PASRR. And finally, we provide good and accurate data. We are looking forward to partnering with the state around reporting and data collection so we can help assist in tracking trends as close to real time as possible so that all of the data remains actionable and can again be driven towards quality improvement. The next two slides are going to talk about Qualitrak specifically. So at this point, I'm going to turn it over to Stephanie Wilson, who is also on the line, so that she can share about Qualitrak as a system. Stephanie, you ready?
I'm ready.
You're up.
Hi, everyone. Thanks, Jean. So I'm going to take a minute and talk a little bit about the actual Qualitrak system. So Telogen has developed a proprietary population health solution. The solution that we're talking about is called Qualitrak and was initially developed in the late 1990s. And the goal was to create a single place where utilization management and care management work could be done, but allow for that true population health solution so that we had the data, the metrics, and the analytics to continually improve that work in our processes. So from that time, we've released additional versions of Qualitrak. So we're in our third major release. Qualitrak is a web-based system that allows users to submit and track information related to members. So at Telogen, we've worked really hard to try to make our portal very user-friendly and efficient. So our modules will step users through the process of building and submitting those reviews and then going back and checking on those to make sure that you know where they are and what status they're in and that kind of stuff. We've done a lot of work to utilize automation in our workflows to ensure that the data gets to the right people so that they're able to do their work quickly and efficiently, and that those users and those of you that are submitting the reviews are notified as decisions are made and reviews are completed. So all of you that submit reviews will be able to receive notification as that review moves to the steps. At Telogen, we take security and privacy very seriously. So we worked to be ahead of industry standards to ensure that everyone using Qualitrak can be aware and know that the information that they're entering is secure and protected so that all that PHI and PII doesn't have to worry about being exposed externally. Like I said, the system's web-based. It's available 24/7 to users, so you'll be able to track the progress at any time that it's convenient for you to do that, and you can do that anywhere that you have a web browser. And like I said, we continue to work to make sure that the system's user-friendly, so any feedback that you have on that is always welcome to help drive that process improvement in the system. And you can switch, yep. So this slide kind of talks a little bit about what it takes to get access to our portal system. We're going to go over this more in depth in the training next week. Jean will talk about more on the next couple slides, but just kind of as a high level, we've developed a provider portal registration process. We've moved this to an online format to make sure that we don't have to worry about getting paper signed and mailed in and that kind of stuff. There's 3 easy steps to get registered. So either an executive or a manager or someone in that position will initiate the process, and they'll go to our web link and start that by entering their information and then indicating the person or persons that they want to be the authorized official for their organization. And we consider an organization like a hospital, a nursing facility, a case management agency. You guys have your own organization and workers inside of there. We recommend that each organization have at least 1 authorized official, but you can have more than that in case someone's, out on vacation or sick or things like that, if you need someone to kind of be that backup. And the authorized official will actually manage the users within that organization. So I'm the executive, I make Jean the authorized official, and then she'll be able to set up and manage all the other people within that organization that need access to the portal. So again, that executive will indicate the authorized official by including their name and email address. The system will then send an email to that person with a link in the email, letting them know that they can click on that and finish filling out all the necessary information. The rest of the information is things like your address, your phone number, email address, all of that, so you can actually collect those details to set up your account in the system. Once that's completed, the information gets sent to Telogen. We'll set up that account, and then we'll send out an email with your username and a link to activate your account and set up your password. The information is currently online, and we have the link where you can go to that registration packet to start this process. You're welcome to fill it out at any time. Like I said, we'll go to more in-depth training on this next week. But just to be aware, in case any of you aren't on the next training, we won't send those links with your username and the link to activate your account until the last week of February. And the reason that we're doing that is because that link for activation is only good for 7 business days, and the portal won't be up and available until March 1st. So we'll start sending those emails out the last week of February, and then you'll be able to have the activation link on March 1st so that you can go ahead and get your account finalized and set up. If you have any questions, feel free to put them in the chat box, and I'll be happy to answer them whenever they come up.
Thank you, Stephanie.
Thank you, Stephanie.
And I do see that we're already getting some questions in the chat, so please keep those coming. We will have time at the end to go through those. Stephanie will be able to answer questions. I'll be able to answer questions. We have OB to answer questions. So we really do value that chat as a good way to let us know what you're thinking of and what your questions are. So like Stephanie mentioned, I am going to cover kind of our next steps, right? So we have 2 trainings coming up following this week's introduction. Next week, February 16th on Tuesday, will be part 1 of our PASRR Level 1 training, where we focus more in depth on how to create those Qualitrak accounts, as well as some basic navigation of the system and how to make requests, how to respond to tasks, what the notification processes look like. So we kind of do a deep dive in the weeds of Qualitrak. And all the folks who are targeted to be that provider executive or that official or the authorized official, we really do recommend you attend next week because that'll really help walk you through those steps. And like Stephanie mentioned, if you want to go ahead and start that process before next week, you can. That website is out there and available for you. That link will be in the slide deck when we publish that following today's trainings. But you just won't get that email until the last week of February, because like Stephanie said, I think it's important to reiterate that that will only last for 7 days and then it would expire. So even if you were to set up everything today, we wouldn't want to email you that last step until the week of February. So just wanted to make sure we touched on that. And again, this will be focused on the folks completing level 1s in the system. Our second training on February 23rd will be our longest training. So today we're going to try to go for about a half an hour, 45 minutes in terms of the content we're presenting. Next week will probably be about 45 to 60 minutes of content we are presenting. And then the week after that will be the bulk of it, how to actually complete the level 1 screen, what that screen looks like in Qualitrak. We'll do a demo of the system. We'll talk about some PASRR level setting. I know there's a turnover that happens. Sometimes there may be people attending this call that don't even know the acronym of what PASRR stands for. So we want a level set for everybody. We will do that on February 23rd. And each training, I can't say this enough, each training will be recorded and available to watch at a later date. We are also going to publish our slide deck as a PDF file. We're going to publish our transcript, and we're going to publish an FAQ, a Q&A from the cumulative of these 3 sessions we've done today, so that all of that information is available, so that if people at your agency weren't able to attend this training in real time, we will have the materials for you to be able to do it with them. If you guys want to have this be a topic of a staff meeting coming up soon, or kind of cool icebreaker to acknowledge us as human beings, please feel free. All the material will be there for you to do that, depending on your learning style. And all of this is really in preparation for our March 1st go live. And I should mention, because it came up on some of the earlier trainings, that the 1135 waiver is still in effect. This transition from EQ to Telogen is not changing the 1135 waiver. That is still in effect until the end of April. So those exempted hospital discharges, needing to get the level 2 completed before admission to the nursing home is still suspended as a result of that federal waiver that Colorado applied for and was awarded. But this is all, the level 1 process will resume to what it was before in end of April, beginning in May. And I can take questions on that if people have additional questions there. So yeah, I wanted to thank everybody for giving us the time to present today, to put names and faces so you can see we're human beings, we're real people, and we want to get to know you. So now I would really like to hear from you. I'd like to take time to answer your questions and hear your feedback. I know that for every one person who shares a question, 5 other people had the same question. And then there'll also be an additional 5 questions that aren't being asked. So please, there's no judgment here. Be willing to ask questions, and we will do our part to answer them. I'm going to pull my chat over here and look at this, so I make sure I can get everything. Oh, and I see that Obi pushed or published our link for the training guides. I will go back to that slide real quick. So this link, let me get my laser pointer out. This link here is where you can see a copy of our training flyers. So if you have coworkers that you want to have attend next week or the week after that, the link for all of that is there. There is no pre-registration required for these trainings. They are first come, first serve, up to 300 people. We can take 300 participants. We did max that out on the last session. So what I would ask is that if you have multiple people from your organization, maybe try limiting it to 1 or 2 people to attend the session in real time, and then share the materials with the rest of the folks at the agency. I know from my personal experience, a teach back moment is really a helpful way of internalizing information when you have to reteach it back to somebody else using materials. So feel free to do that as well. And then again, the other important website is where the link to that portal registration. Now, the link to the portal registration is on the long-term services. Many of you are from case management agencies that will be utilizing Qualitrak potentially for other tasks as well. So Qualitrak is Telogen's portal. We are using it for both PASRR and other task work as well. And if you create a Qualitrak account, that'll be your one account to Qualitrak. You won't need multiple accounts per task that you may be doing in Qualitrak. So this registration packet is linked here under long-term services, while our PASRR specific trainings are located here under PASRR. So that's the difference. Qualitrak is not PASRR specific. This training is PASRR specific. So just in case you're curious why we have multiple links, I'll explain that. So that's the link that Obi shared in the beginning. And then we have our case managers notified through email. This is a great question, Jay Perla. What I will say is that Qualitrak has a built-in visibility feature. What this means is that any individual whose user account is tied to an MPI, a Medicaid ID number, a unique identification number of an agency will be able to have visibility to anything else that's under that provider type. For example, if Susie submits a PASRR level 1 for a member, but then the member changes caseloads and ends up with Johnny over here, Johnny can log into the system. And because both Susie and Johnny work at the same agency, they can both see the request, even though Susie's the one that submitted it. Johnny can see it too. And because we can add multiple providers to the requests and the documentation in Qualitrak, the case management agency, a hospital, a nursing home, multiple nursing homes, if we're not sure where the member is going to end up, because during the PASRR process, there may be a change in the admitting facility. All of that is connected at the level of the case in the Qualitrak system so that that visibility can be shared. So that's where case management has the visibility to that. In terms of notifications through email, the submitter, the individual that first started and submitted the case, is typically the one that's going to receive the email notifications. But again, visibility can be agency-wide, which is great. And then also the fact that those notifications are not agency-wide is also a benefit so that people's inboxes don't get flooded with information they don't need. So the email notification specific, visibility global. Angela Berry has a question. Can the provider executive also be registered as an authorized official? Good question, Angela. We got that on the last training as well. And yes, they can be the same person. Most definitely. You'll just have to put your name in multiple places, but you can have the same person. Next question. Will previous PASRR information and records from EQ Health be transferred to Qualitrak for users to access? Another great question. We did cover this the last session as well. Telogen will have access to all of the previous documentation from the EQ system. However, it is not going to be migrated into Qualitrak. So if you do have a need for any previous records or previous documentation, I'm going to flip the slides to Obi's contact information, right? Obi, are you the one that would help them if they needed older information?
Yes.
So if you need information that you can't find in Qualitrak on a previous PASRR record, that's the guy to talk to. But as far as consistency in a record goes, Telogen will have that clinical continuity from what was in EQ Health, which is great. Okay. Yep, PASRR 30-day exemptions for pre-admission. Thank you, Obi. Ends on April 21st. So that's when the 1135 waiver, which is currently allowing for suspensions of PASRR, will end on April 21st. Next question. Will case management agents or case managers at single entry point agencies be able to see if a hospital has already admitted the level 1? That's a great question. So our system of Qualitrak functions very much like an EHR. So it's very member centered in that each member has a member hub and you can see all of the things that have happened to that member. You can always look up a member and see their member hub if you have access into our system. However, you may not get to see the information about them unless your agency has been granted visibility. So if a hospital grants visibility when they create the level 1 to the case management agency, which they will be able to do, then anyone at that case management agency would have ability to see the level 1 and the entire PASRR process as it moves through because that visibility had been granted. So I think there is a way to do that. I think we're going to have to really communicate between all these different stakeholder groups about how to make sure everybody gets the relevant information they need. Because again, once a provider has been added to a PASRR, you get the visibility for that. So we did anticipate having to have multiple providers. So we have adjusted our Qualitrak system to accommodate that. We also recognize that the admitting facility or the nursing home that's been identified might change. You may have a nursing home ABC that you're going to try to admit to, but all their beds are full. Nursing home HYZ has a bed date available, and actually they're closer to where the family is, so we're going to go with there. So our system has the ability to adjust who the admitting facility is. At the same time, we can add case management at any point during the process. How do we register for the provider, executive, and authorized official, or where? That would be that website. Let me go back to it again, just so people can see it. There we go. So this is the website for the registration packet. Again, no rush. We will cover this next week. However, if you want to go ahead and start early and poke around, please feel free. It is there for you, but it is not required. We will cover it next week in depth. So it's up to you. Next up. So can a case management agency and the hospital view the portal? Hopefully I've covered that with our comments about visibility. We will be covering that more in subsequent trainings. So Jay Perla, if I haven't answered your question, please resubmit and let me know, because I think I covered that already. Next question from Rachel. If our agency becomes involved in a case down the road, like at a continued stay review, will we automatically be added, or will we need to request access to the client's record in the Telogen portal? That is, again, getting to this aspect of visibility. Providers have to be added to cases by someone who already has access to the case. Once that has happened, then anybody at that facility that's been connected with their unique provider ID through the Qualitrak registration process would be able to see that at any point in the case. So hopefully that answers that question, Rachel. If not, reach at it, let me know. Susie, may I clarify, does this mean that beginning 4/21, we are to complete level 1 or ensure all applicable PASRR has been completed prior to admission? I'm going to let Obi take that just to make sure that we've got the same message.
Thanks, Jen. Yeah, it is beginning April 22nd.
Okay.
We will be required to complete pre-admission level 1s, level 2s. So basically, before admitting to a Medicaid certified nursing facility, the NOD will need to be in place before the admission happens.
Okay.
And that is effective April 22nd.
Okay.
And again, Jean, may I add something that I told the other group? I think it's fair to, try to stay consistent with the sharing of the information.
Yes.
I have shared with the other groups that it is possible that I'm getting into a little bit of speculation, and but I don't want you to misunderstand what I'm saying. But I'm saying right now, it is possible that we may extend. We have not made that decision yet. So I just want everyone to plan that PASRR requirements will be resumed effective April 22nd. And if a decision is made to extend that 30-day exemption, we will, as usual, we will communicate with providers in advance. Mm-hmm. I hope that helps.
It does. And to summarize that, write it in pencil on your calendars, not in stone. 4/21 is the date. Okay. There's a couple more comments here about visibility, saying that yes, the communication is important, and we believe that. We do not want duplication of effort. So if there's a way to get you access to what's already there without you submitting something brand new, that's our goal, is to make sure that visibility is useful. We worked very hard to make sure that the Qualitrak system can accommodate multiple providers. Between case management agencies, hospitals, nursing homes, multiple nursing homes, change in county. If the member changes county from one center board to the other, we really want that to be able to work in our system. Next question from Michelle is, if the PHE is extended, that's what we just talked about, the public health emergency, which is what triggered the 1135 waiver. then yes, you're correct. The PASRR will also be extended because those two things go together.
Can I add a comment, Jean, please?
Please.
So for Michelle, if the PHE is extended, then us doing PASRR is also extended, right? Not necessarily. A separate decision will have to be made by the department to extend the PASRR 30-day exemption. Just extending the PHE does not automatically trigger an extension for the PASRR program.
Okay.
That is a separate decision that the state will have to make, whether or not to continue to exempt the pre-admission level 1 and level 2s, or to go back to normal. So like I said earlier, and I apologize for being repetitive here, currently our plan is to resume PASRR requirement by April 22nd. And if between now and the end of the month, if there's a decision made to make a decision to extend the 30-day exemption, we will communicate with you in advance. So for case management agencies, so basically you should be planning to start completing level 1s by April 22nd. So the March 1 effective date is not necessarily going to require you to do anything different. I hope that makes sense.
Yeah, that's a good clarification, Obi, that the public health emergency declaration is not tied to the 1135 waiver extension. So thank you for clarifying that. And also that the Telogen go live date of March 1st is not connected to the 1135 waiver. So those dates are completely independent. Thank you. And then we have some more questions here about the visibility and what happens if the case is, if it's after the case has been discharged, that we need to add it. And so one of the things we've really worked to accommodate is that visibility, you can change and update the visibility for providers, even after a case is closed in Qualitrak. Part of the reason for this is for places, people that transfer from one nursing home to another, their admitting facility will change from what it was the day they admitted. Maybe a week later, they move somewhere else. We want our system of Qualitrak to be a good and accurate system of record. Same thing, if a case management agency changes from one county to another, that would need to happen. And again, anybody with current visibility can add anybody else to that. So that's where the ownership of adding visibility to the people that currently have it. And then once they've been given visibility, anybody else will be able to see it. And we'll cover this more again in subsequent trainings. Slide deck will be published. Where will it be available, right? Nope, let me give you that website. Everything will be here under the PASRR specific website. So our slide deck, our recording, our transcript, our FAQ documentation, everything will be at this link, which is where the current training flyers are. So this will be the link to go to. And we're finishing up our trainings for this first brief introduction today. So look for documentation to be published by the end of the week. And we're going to make sure everything meets compliance, 508 compliance standards for everybody as well. Okay. Any other questions? Did I miss anybody or miss any other questions? Okay, I have one more slide to cover. And then, like I said, if anybody else has questions they want to trickle in while I'm on the last slide, please feel free. We want to hear your questions. But in summary, I want to leave you folks with a few key points to drive these home. PASRR is a person-centered process to provide an objective clinical assessment for folks that could potentially benefit from additional services at a nursing home specific to a PASRR condition. Nursing home transitions are vulnerable times for individuals and their families, and we want to be mindful of that in how we approach PASRR in Colorado. Very important. PASRR is also a federal requirement that's been around for over 3 decades and continues to maintain relevance and provide benefit for individuals. PTAC, the PASRR Technical Assistance Group, publishes webinars every month, new content every month. The notice of proposed rulemaking went into effect came out in 2020. So again, updating it now. PASRR is a clinical opportunity and not about paperwork compliance as a primary objective. It's a secondary gain, but it's not the primary objective. We really do believe that there's a great deal of clinical utility that comes from having an outside objective eye mindfully review and assess an individual when appropriate. And if not warranted, then quick turnaround and closing out the PASRR process. We do not want it to be a barrier if it's not going to have utility for somebody. Turnaround times and utility of the output documentation matters and is key to the success of a PASRR program. It should not take you weeks to get actionable information as you look to begin working with new residents or new members. You shouldn't have to wait for feedback around the appropriateness of a nursing facility specific to a PASRR condition. The documentation that is provided post level 2 should add value and be consistent. By leveraging our system automation, having a unified team, and our reliance on telehealth, we feel confident we can help improve this process for all PASRR stakeholders. And lastly, Telogen is committed to hearing directly from all stakeholders so that we can evolve the process as needed based directly on your feedback and maintain the best efficacy and satisfaction for all involved. That's very important to us. And I don't see any new questions as we were going through that. And we did say we take about a half an hour, 45 minutes. We're at 41 minutes. So I'll jump to my very last slide here. Something that I always like to do when doing trainings for groups of people is to leave you with 2 thoughts. We spent 45 minutes together on this Tuesday afternoon. What was your takeaway? What little piece of information, nugget about Telogen, maybe it's that Shelley Voss loves Palisade peaches, whatever your little nugget of wisdom is, something that you took away from this that's unique for you. And then what, if anything, will you do differently as a result? Will you talk to people differently about PASRR? Will you talk to your coworkers about it? That I really do appreciate. So I think another comment just came in. It seems like the focus of the person-centered approach and in the best interest of the client, maybe SEP should be removed from the PASRR process, especially now that universal visibility can be obtained. Any discussion about removing single entry point from this process? I think maybe that's a question I'll kick over for Obi. I'm not sure if that's something we can address on this training or if that's something you want to cover at a different time. I think that's our last comment. Okay. We ended up having 180 people attend today. So I thank all of you very, very much. Obi, you want to cover this?
Jean, can I say something? Can I say something to the last comment?
Sure.
It says any discussion about removing SEP from this process. And I hope I'm understanding the question correctly. There is no discussion about removing SEP from the process because in the Colorado PASRR rules, the SEP is actually one of the required providers to complete the PASRR level 1 assessment. So there is no discussion that I'm aware of to remove SEP from the process.
Okay. Thank you. See, this is why we had everybody on the call. We wanted all the experts in the room to be able to answer these initial questions. Okay. Hopefully it is very user-friendly. I just saw the last question. That's definitely our goal. I will also speak from personal experience. I am a provider. I complete these level 2 assessments in Montana in addition to running the program. And I think it's very user-friendly system, very easy to use. We've really tried to streamline the process. Our level 1 form is different. It's much more simple and streamlined so that we can get utility and get things turned around quickly for people. So, all right. Thank you very much, everybody. And
also, just
oh, go ahead.
Sorry to interrupt. If somebody said I'm not worried about doing a PASRR, I agree with you. I'm super excited. We are really lucky to have Jean and wonderful team from Telogen, Jim Pam, and the rest of them. I feel very confident that we will reach our goals, with regards to the PASRR process. One of the things that I want to point to, which we're going to get more information on this in the next 2 trainings that are coming up, is the instant notification for the level 1. up until now, at least as far as I know, for the last 4 years, we've not been able to execute that feature in any of our previous vendors. Now, Telogen is going to be providing that feature where when you submit your level 1, you should be able to get an instant notification if there is no PASRR condition, there's no suspicion of MI or IDD. And that is one of the areas that we're going to be having a huge improvement in our turnaround time. So I'm really excited about that. And you're right. I feel, I feel good about, where we're headed with Telogen.
Thanks, everybody. We will be talking again next week. So share the good word. Let people know to come next week too. More to come. We are over communicators rather than under communicators. So we look forward to seeing you next week. Okay.
Thank you. Thanks,
I will go ahead
everyone.
and end this meeting. All right. Bye, everybody.
Thank you.